Next, we will have Dale Fountain, Chairperson and CEO of Enact Universal Healthcare for California. And if I may, just extend my apologies to Dr. Paulin for getting the school wrong.
Good morning, Assembly members. I'm Dale Fountain, Chairperson and CEO of Enact Universal Healthcare for California. Thanks for having me here to talk about the California Healthcare Roadblock Removal Act and why a constitutional amendment is needed to allow healthcare funding. The audience for this presentation isn't just the entire legislature, but the general public. The legislature is intimately familiar with Prop 4 and Prop 98 in all their budget calculations each year, while the general public has all but completely forgotten. My presentation will build on the testimony given to the same committee on Monday, February 5th. So please go ahead and pause this video if you're watching at home, watch that one and come back. So a little about what we're doing. Enact Universal Healthcare for California is sponsoring a ballot proposition for 2018, the California Healthcare Roadblock Removal Act, or SHRA, as I like to call it. It will not by itself implement universal health care, but it will enable any future health care legislation in the state without having to go to the ballot each time. Here's an example of how our Constitution would apply not only to universal health care or incremental legislation, but to any cost controls such as global budgeting or a statewide buying pool for pharma. Total health care spending in California is $400 billion. And if the state simply held that and paid it back out, $200 billion would automatically be sent to education via Prop 98. Prop 4 would rebate $188 billion from the other half back to the taxpayers. Healthcare would be left with almost nothing. SHRA costs nothing in itself and is specifically written that way. Even the Legislative Analyst's Office found it will have no direct fiscal impact. If passed, the legislature can then pass an entire healthcare system, or it can do it incrementally. Having to go to the ballot will no longer be an excuse for inaction. SHRA exempts healthcare funding for Prop 98, the minimum funding guarantee for education, and Prop 4, state spending cap, aka the GAN limit, but otherwise leaves these restrictions intact. All right, so let's get into a little history. The picture on the left is Howard Jarvis and Governor Jerry Brown. The picture on the right is Paul Gann. In the 1970s, California homeowners were seeing their property values soar right along with their property taxes. Some were getting taxed out of their own homes. Californians were begging the legislature for relief. In 1977, there were a few proposals bounced around the legislature, but nothing passed. Howard Jarvis and Paul Gann came up with their own plan and got it on the ballot as Proposition 13. If the legislature in 1978 had simply passed anything to lower property taxes, Prop 13 would not have gotten momentum. All hell broke loose when people found out their property taxes were increasing that year, some by 100% or more. Prop 13 passed in a landslide. Initially, Governor Brown was opposed to Prop 13. Then it passed. At that point, he became, in his own words, a born-again tax cutter. In 1979, Governor Brown teamed up with Jarvis and Gann to put a spending cap on the ballot, which became known as Proposition 4, aka the GAN limit. The fallout from Prop 13 was immediate. The school districts lost $5 billion in tax revenue, which the state depleted its own reserve to backfill. But with the state taking a gut punch with Prop 4, taxes could not be raised with other methods. In the 1980s, many schools closed, consolidated, and cut programs. Infrastructure projects such as freeways were put on hold or canceled entirely. In fact, in the district I grew up in, the city of Glendale, Assemblymember Friedman's district, she should remember this, Clark Junior High closed, and the 2 freeway project is left unfinished to this very day. In 1987, due to Prop 4, and despite the ongoing funding crisis, a $1 billion surplus was rebated to the taxpayers. It didn't take long for the CTA to put Prop 98, the education funding guarantee, onto the ballot. The point being, had the legislature listened to the people who were crying out for relief, none of this would have happened. All right. For those who don't know what the GAN limit is, here's a simple diagram. Please don't stare at it too long. According to the LAO, we have about $12 billion in room as of last month. Here's one of the figures from the Prop 98 handout that the LAO gives to new legislators. Minimum funding is based on a formula that can go no lower than 39% of the budget. Right now, we're around 50%. Current K through 14 funding totals $75 billion. As you can see, it's not unusual for Prop 4 and Prop 98 to be overridden by the voters for exemptions. We had 2 on the ballot in 2016 that passed. If you notice there, so Prop 98, Prop 111 was the transportation funding, which was actually in disguise, it was actually a modification to the GAN limit and Prop 98. Prop 10 is Children's First 5. Prop 1A is the local taxes go to local authorities. Prop 52 is, which was just in 2016, that passed by 70%, and that was the hospital tax, and that was another exemption. Prop 56 is another tobacco tax. All right, popular counter-arguments to the ballot measure that I've encountered. Other than the people who deny Prop 4 and Prop 98 exist, here are the popular arguments. We can just ignore GAN and Prop 98. And, well, good luck with the lawsuit by Howard Jarvis Taxpayers Foundation and the CTA. Governor Brown himself last year, he tried to say, hey, we can just do something with nowhere money. And he backed down when Howard Jarvis was going to sue. And in fact, it's kind of weird when you're the one who put it on the ballot and you are going to ignore it. So the next one is just put GAN and Prop 98 exclusions into a legislative bill. It is weird to hear people not understanding civics. It needs to either be a ballot proposition or with petitions, signatures collected and then go on the ballot, or a 2/3 majority through the legislature and then go on the ballot. Each time it has to go to the people. The next one is a little bit in there, a little bit more wonky. Its premiums are like Snickers bars or user fees. User fees must provide a tangible service, such as bridge toll or vehicle license fee, driver's license, etc. An insurance premium is not a user fee. In fact, you can pay into insurance all you want and never get anything back from it. How does that even work? I even ran this by a judge friend of mine, and he just laughed at it. He said he wouldn't believe that somebody would actually bring that up to him. So to further distinction, part of it is intent of the Constitution itself. Article 13B, which is the GAN limit, in Section 8A, explicitly exempts disability premiums. That's another health insurance on there. Okay, so this is a wall of text, and I apologize. This is from Ben Javerser, who wrote an article on this just this last month, how the GAN limit interacts with cap and trade. It was featured in Scuttle blog. It's a very good question because cap and trade is not subject to the GAN limit. And the only reason it's not, or the short answer that all this alludes to, is that cap and trade is an auction. It's not mandatory that you participate in the auction and is therefore not a tax. If you were going to claim something like, well, the state is selling something, that is also excluded. Like a state asset is also excluded in calculations for the GAN limit. I wouldn't consider insurance as a state asset, and I doubt anyone here wants to run a healthcare system as an auction. Okay. So Dr. Graves, he was here Monday. That's why I asked people to tune into that. He also wrote an article in the California Budget and Policy Center last year in July. And this is basically his conclusion. In short, rather than trying to devise a clever and likely counterproductive way to avoid going to the ballot, single-payer advocates would be well advised to ask California voters to remove the key constitutional obstacles to the implementation of a single-payer system. He goes into a lot more details. The GAN limit can't be gotten around. There are instances where Prop 98 had been ignored, but is for small increases, like small increases to a local sales tax. But nothing as huge as, say, $105 billion in taxes that we would need to do in order to, say, for SB 562. Even though that's not on top of anything, that's just a shift in revenues, that's still something that the state says is proceeds of taxes. So we wouldn't be able to do anything about that. So that pretty much ends my presentation.
Thank you very much. Next, I have